I did put up here too the thpmedicare.org/Medicare. This is our public-facing website, but it's also a great resource for a lot of comparison plan guides, all the supplemental benefits, finder provider directories, and RX directories. So we're going to take a look today at the first look presentation. Just to kind of introduce ourselves a little bit, Travis Dews is our National Sales Director. That is his information, and my ugly mug is on the right-hand side there. There's my cell phone. You can call, you can text, and you can email me. I'll leave it for just a moment here. And as we're waiting here, so Trinity Health came out in 2024, so this year, in the state of Michigan. However, we have been in other states, including Ohio, Iowa, Idaho, and New York. We did begin as a Medicare Advantage only company down in Columbus, Ohio, in the Mount Carmel Health System. Trinity then did acquire us, and we've been rebranded in each of the states we have. For Michigan, of course, we have the Trinity Health headquarters just being down the street here. So today we're going to take a look at the plan design that we have. We're going to take a look to see what differentiates Trinity from some of the other carriers that you've heard from today, and also kind of make an action plan for getting Trinity into your portfolio as one of your carriers. So why represent Trinity Health Plan of Michigan? So as I mentioned, Trinity Health has acquired us, and because of that, we are wholly owned as a hospital network sponsored plan. Because of that, we share the same faith-based mission that Trinity does, as well as the not-for-profit structure. So why that's important is, at the end of the year, when the profits come in, we're not beholden to shareholder dividends. We reinvest that money back into the hospital plan systems for your members' access to care, as well as the plan design for the following year. We also routinely, throughout the year, work with a board of volunteer producers and specialists who give their accounts of kind of the front line on what they're seeing in the healthcare system. And we are going and working with that to design the plans in response to that feedback. So when we came in 2024, we started in 6 counties. Those are the ones listed in purple and up at the top there. And I am proud to say that Trinity Health for the state of Michigan had the most successful state launch in our company's history. And a large part of that was due to our broker channel. They owned 40% of our sales in that first year. Because of that, we have now expanded into 11 counties for the 2025 year. Those are the ones listed in the lime green there. And really excitingly, Oakland, Wayne, and Monroe County are being added. So we're very excited to be moving into these counties. You should take a photo if you need to. And we'll talk more about, proposed. We are definitely looking for 2026. Macomb is definitely on our radar. It's looking very good, especially with the Ascension merger with Henry Ford later on this month. And also kind of closing in on the center counties like Ionia and Clinton. All right, our large provider network. So one thing I want to get across is even though we are a Trinity Health plan, we are not just Trinity. We have a very large network within the state. We'll talk about that in the next slide. But just to kind of give you some numbers here, we have over 42 hospitals in our network system. Last year at this time, we had 16. So we have tripled that number. We have over 3,000 primary care physicians in network, over almost 12,500 specialists. Last year at this time, that was at 6,000. 88 plus behavioral, ancillary, and health clinics, and we have contracted nationally with over 65,000 pharmacies. All right, as I mentioned, we are not just Trinity Health. We are very blessed and fortunate in the state of Michigan to have world-renowned hospital systems, as well as wonderful regional partners. Included in that, when we came into the state, we knew the importance of the reciprocity between our regional players. So I'm proud to say that in our current network right now, we do have Corewell Health, we have Henry Ford Health, Holland Hospital joined us, as well as McLaren Hospital Systems earlier this year. That was backdated to January. We have the Metalodge Nursing Home Chain, the Northern Ottawa Community Health System, Michigan Medicine, the PHP, their combination there. We have them now in network with the Sparrow Health Hospital merger. And of course we have our Trinity Health and IHA clinics. And we're always looking to increase that broad provider network for our plans. So of course you probably have all heard, especially HAP was probably talking about their merger with Ascension. We are waiting for that. We have been in talks with Ascension. They've said that they're going to agree to our network as well, so they'll be added on once that merger is complete. We're also talking with the Battle Creek Health Systems, and we're in early talks with Bronson Healthcare. So these are just kind of some of the negotiations we have to expand that network. Some of the competitive highlights. So our kind of what brought us onto the map here was our Part B give back plans from last year. We had a $150 give back for our cashback MAPD. That was a Social Security kind of Part B reduction. I am happy to say that that number has actually gone up for this year. It'll be $161.80 per month for your member. All our plans are $0 premium, $0 medical deductibles. We have 3 HMO plans on the market this year, once again. 2 of them are MAPDs and 1 MA. We also have a flexible benefit card used for vision and hearing services and co-pays that is embedded in each of these plans. $0 primary care physicians, low max amount of pockets, and your tiers 1 and 2 will be $0 for that mail order systems. We also have embedded $1,000 of embedded comprehensive, basic comprehensive dental through dental providers, through the UHC network, benefit providers, I'm sorry. And we'll get more into the green box here on some of the other embedded supplemental benefits. Of course, the big news this year, to no one's surprise, was Part D and the big changes that it's had. So we have also, as a carrier, had to kind of pivot and maneuver to these changes. But what you can see with the Part D highlights is, of our 2 MAPD plans, our no premium plan has a $0 medical deductible for all tiers. And our cashback plan has a $350 prescription deductible, but only for tiers 3 through 5. So your members who are on those generics will be fine. As I mentioned before, we are contracted nationally with 65,000 pharmacies. $0 tier 1 on both plans with MAPD. And then finally, tiers 1 and 2 are $0 through mail order system. We partner with CVS Caremark for our mail order, our OTC vendor, and we utilize the Caremark core formulary. Also, extremely important in this line of business, this year probably more than any, is retention. So why are your members going to stay with Trinity? On average, we have our members enrolled for 95 months, just shy of 8 years. We have a total of 479 members that have been with us for 25 plus years. And we have, as of June, 134 members with an effective date of 1997, which was the year that we first initiated these plans. We have over 51 members over the age of 100. Our oldest member is 110 years old, down in Columbus, Ohio. And last year, she switched to a cashback. Amazing.
That's awesome.
Equally important are the claims. You've got to have a carrier that pays their claims. We pay quickly with limited denial. Most importantly, we have only 7 prior authorizations. We are adamant about trying to remove the obstacles for your members and their access to health care. 99.9% of our claims are paid within those first 30 days. 97% of those are now being received electronically, and 99% are paid accurately that first time. Our claims teams sits in quarterly with our sales team. They listen to our concerns, our needs for the brokers, and they work diligently to make sure that that is not an issue for you. Because nothing worse than having a busy schedule, and then you get a call from an irate member, right, about claims not being paid, and then you find yourself on the phone for 45 minutes. Along with this great presentation that our marketing team put together, we also have a strong print material presence that you'll see out in the wild there. So you might have seen some billboards, especially on the west side of the state. There's quite a bit advertising our plans. And these are just kind of a sample of what potential members or renewal members might be seeing coming into their mailboxes. Prioritizing the cashback plans, some of the plans we have in the market, as well as new Medicare destination guides and things like that. It's not just print material. We'll also be doing radio and TV ads. Any football fans here? Okay, good. Go Lions, right? We will be on the local channels for the Ohio State versus Michigan and the MSU versus Michigan game as well.
Go Blue.
Go Blue. All right, what you're really here to see. Now, again, a caveat to this. This is our second bid that we put into CMS. We feel very strongly that this will remain through to October 1st. But of course, it has been a tumultuous year. We all know that. CMS can pull the rug from everyone's feet. So this is what we are hoping to have by October 1st for you. We are going to return with our same 3 plans as we did last year. We have our no premium, our cashback, and what was our cashback MA proved to be a little confusing for signups and enrollments, so they've renamed this to the Glory Noir Packs. As I mentioned before, all 3 plans are a $0 monthly premium. And you will also notice in row 2 that every single of these plans has a Part D give back this year. Now I'm going to stop on the cashback real quick. The way this works is your member has to have 2 qualifications to receive this cashback. 1, they must be collecting Social Security. 2, they must be paying for the Part D premium in full. So if they're having any type of government assistance that is reducing that Part D benefit, they can be on the plan, but they will not receive the money back on that premium. So $14.50 for the no premium, $161.80 for the cashback, and $100 for the glory. Annual out of pocket, $4,500 for the no premium, $6,700 for the cashback, and $5,500 for the glory. The flexible benefit card that I had mentioned before, $500 for the no premium and glory, and $250 for the cashback.
Wow.
$0 primary care physicians, unlimited copay for that for your members. Our specialty, our specialist copays, $30 for the no premium and glory, and $40 for the cashback. And then finally, the OTC benefit. So again, that is through CVS pharmacies, the CVS Caremark. This is a quarterly amount. This amount does not roll over. So just make sure that if you have a member that is interested in utilizing these funds, get a t-shirt that says, use it early, use it often. $115 for the no premium every quarter, $50 for the cashback, and $100 for the glory. All right, additionally, moving on, inpatient hospital copay stays, $300 for days 1 through 6 with the no premium, $395 days 1 through 5 on the cashback, and $275 for days 1 through 7 on the glory. Outpatient surgery copays, $250 at the lowest with no premium, $350 for the cashback, and $275 for the glory. Prescription this year, so this was kind of the change that a lot of carriers had to pivot to. As I mentioned before, the no premium has a $0 drug deductible. There is a $350 drug deductible for tiers 3 through 5 on your cashback, and the glory, of course, is now applicable in this case. Tiers 1 is going to be $0 for both plans. Tier 2, $0 for the no premium, and $5 for your tier 2. And again, tiers 1 and 2 through a mail order is going to have that $0 copay. And then we move to a coinsurance. So we have tier 3 is 25%, tier 4 is 50% coinsurance, and then finally for your no premium, 33 for tier 5 and 28 for the cashback.
Quick question for you.
Yes.
Why does it have to pay 9 times? So it says 0 days, 6 to 9, and $0.
I believe it's actually and beyond is $0, but they did just have that as a qualifier there. With that formulary detail, again, that's the core formulary. So, fortunately, 89.7% of all prescriptions dispensed are generics. You're going to see a huge push by all carriers this year to drop the name brands if possible and move to a generic supply for their members. 48 out of the top 50 utilized generics by day supply are on that tier 1 and tier 2 on that core formulary. Tiers 1 and 2 with no drug deductible includes cardiovascular medications, including ACE inhibitors, your ARBs, your statins, and your cholesterol diabetic medications. I'm moving over to that green box that I showed you earlier, the supplemental benefits. So dental, embedded into each of these plans, is $1,000 maximum allowance for basic and preventative comprehensive dental. So this is going to include your exams, your cleans, your x-rays, the things that we've kind of come to expect here. If that's not enough, we do have 2 optional buy-up dental plans for your members. Now, these buy-up plans are only available for the no premium and the glory. So unfortunately, the cashback's not available in this. But we do have our silver plan. It runs $15 a month. You can add $500 for a total of $1,500 maximum allowance. It's going to be a 50% co-insurance for your minor restorative services. So things like root canals, fillings, more things beyond a simple extraction. And then if that's not enough, or if they need more care, we do have a goal that runs $39 a month, and this is going to add $1,000 for a total of $2,000, and this is going to be 50% co-insurance for major restorative services, so dentures, bridges, and crowns. No waiting periods on these. The dental vendor is dental benefit provider, so that's the UHC network. We did not change our vision or hearing vendors from last year, so we're still staying with Spectera for our vision and True Hearing for the hearing vendors. Both vision and hearing have a $0 copay for that initial vision or hearing exam, as well as a diabetic retinopathy exam and a hearing aid fitting and evaluation. Anything beyond that is a specialist copay. With the Spectera, we have over 107,000 private and retail chain clinics available in our network. Again, that ease of access of care for your member. Additionally, we also have a hardware allowance of $125 for the cashback and $225 for the no premium and glory. And this can be used on things like frames, lenses, and contacts. On the hearing aid side, we partner with True Hearing to take their 2 highest model sets for hearing aids. They're advanced and premium model sets, and they have where these run retail about $2,500 to about $3,200. We've brought these down to more affordable copays between $599 to about $899. Now, what's nice about this is the flexible benefit card that we're going to talk about in a second can be utilized to pay for these copays. So it's a nice way to double dip the benefits. And speaking of the flexible benefit card, this is what it's going to look like in your member's welcome kit. It is a pre-activated, pre-authorized Visa card. It is already set with the funds, and what will happen is it will only unlock for vision and hearing expenses and co-pays through those merchant codes. But there is also, with Trinity, pushing a healthier lifestyle. If a member completes 2 different member rewards programs, so an annual physical or wellness check there, or an in-home assessment, they will receive $50 in a digital wallet on this card that can be used for anything but the real fun stuff like alcohol, guns, and lotto. So other supplementary benefits, we do have post-hospital discharge meals through our GA Foods vendor, 14 meals over a period of 7 days, chef cooked, designed for nutrition and a focus on recovery. We do have the over-the-counter allowance that I talked about before through CVS Caremark. We have our 24-hour nurse hotline, award-winning. Members can call in, asking any questions that they need. A licensed and registered nurse can answer. We do have a travel benefit. I just want to take a moment to say on this because we do have HMO. These are all pre-HMO plans, so we do recognize the limitations with network. So the travel benefit is kind of a way for us to assist members who need to do a lot of travel outside of the state for a period of time. The intention for this travel benefit is for routine care. So you are always covered under your emergency and urgent care under your Part B provisions. But with the travel benefit, if a member is traveling outside of the state, but still within the U.S., for more than 7 days, they can call member services before they leave. Let them know the provider or the facility that they're going to utilize, and then that will turn online for them. They will receive in-network charge when they go to see that out-of-network provider. That money is $1,500 for the cashback and $3,500 for the no premium and glory. So until they get to that charged amount, they are within network for those providers. We have also taken a move as well. We were with Silver Sneakers. We did move to one pass, and we have seen that to be a net positive. There are far more gym and fitness locations, including a lot of boutique services like Orange Theory, Yoga Lab, and Stretch Fit. And there's also a lot of nice extra opportunities like social programs and mental cognitive programs as well. We do have acupuncture if your thing is about getting stabbed with needles. $20 a visit, you get 6 for the cashback or 12 for the no premium and glory. All right, why partner with us? So like I said, $19.41 cashback annually with our cashback plan, backing your members' Social Security, $0 premium plans on all three, $0 medical deductibles. We cover the top 100 most prescribed medications on the market. Hearing, vision, and dental benefits, you get those $0 co-pays for those initial exams. We have the flexible benefit card that's added into every one of those plans there, and solid supplemental benefits, including the OTC allowance, the travel allowance, the vision, hearing, and the free fitness membership. Again, retention, while your members will stay with us. Our member services is located down in Columbus, Ohio. Please don't hate them because they're from Ohio. We love them. They're in the U.S. They're there to answer. We have about a 30-second answer time during the off season there. Additionally, we have all of the wonderful hospital systems here in Michigan, a large, strong provider network. 7 prior authorizations only for our plan. No referrals to see any network specialist. And then there was news that earlier this year, amongst all the other news, there was a redetermination clause through CMS where they realized that they messed up on a lot of their star ratings. And fortunately, Trinity was one of 7 carriers to receive a 5-star plan in Ohio and Iowa's markets. Michigan, of course, is still too new to receive star rating. But the plans that I've showed you today were built off of those same plans that received the 5-star. Then finally, we have our claims and our adjustments and all that are paid within those first 30 days with a 99.88% accuracy. And what you can get from your certification. So a raise of hands, is anyone certified this year? Got a few? Was it easy? Yes, I'm getting a yes. Good. So we don't have a test with our certification. We just require an EHIP or a NABIP Medicare certification for the year. End to end should probably take you about 20 minutes, if that. We do allow the maximum CMS commission. And until CMS says otherwise, we are continuing our health risk assessment program. We pay $125 per health risk. You have a local dedicated broker, that's me. I live in the center of the state, so I'm usually ping-ponging around each side of the state there, but I do try to get your questions answered as soon as possible. We do have assistance with marketing and recruiting. We do love working with our local GAs and helping however we can. We do have a lead incentive program, especially during the AEP season coming up here. We do pull off all our field agents out of the field, and we rely wholly on our broker network to run our sales seminars and run our information booth stations that are in the hospital systems where your members are getting their treatments and procedures. So final question is, how can we help you? How can we get Trinity into your portfolio? I want to thank you guys. It's been wonderful. And if there's any questions, I know we're on a time crunch, so I think I'll answer them out at the booth there. Thank you.